Hi everyone, my name is Cami Thurlby and I'm a graduate nursing student at Aurora University, and this is a teaching presentation that I have put together on managing chronically ill patients. I've been a nurse for almost 7 years now, and I currently work in case management and care management, and what I have come to experience is that there's a real lack of knowledge among nurses and other healthcare professionals about how to manage chronically ill patients in today's society, what kinds of resources are available for these patients, and what kinds of services should be provided to them. So I'd like to talk about a couple of talking points in this presentation. The learning objectives include the learner being able to define palliative care and being able to determine when a consult is appropriate for palliative care. The learner will also be able to define hospice and be able to determine when a consult is appropriate for hospice. And lastly, the learner will be able to explain the process of advanced care planning. The goals for the presentation include to have an understanding of the types of care available to patients with chronic illnesses. And the learner will also have an understanding of the types of conversations that healthcare professionals need to have with these kinds of patients. So these goals are more broad, more of an umbrella that will encompass this presentation. So America's population is aging rapidly, and as this occurs, more and more people are living with multiple chronic diseases, with the limitations of managing personal care, of where they're able to live and with what degree of independence. Trips to the emergency room and hospitalizations frequently occur. Prognosis and treatment plans may become uncertain. Patient goals and preferences may change. And often there is stress and crisis among patients and their families. Along with this, people must struggle to navigate a fragmented care delivery system that is unprepared to respond to their goals and preferences in the latter stages of their life. And then there's technology, in many ways the great blessing of our age. But in a world of serious illnesses, technology has the perverse potential to keep people alive regardless of their condition or what they actually want. Finding ways to help patients cope with chronic illness and plan for a functional lifestyle is crucial in order for our healthcare system to be successful. Therefore, it is important for nurses to be educated on how to manage patients with chronic illness. Improving health outcomes for patients with multiple chronic conditions has become central to achieving the goals of better care, health communities, and affordable care envisioned by the National Quality Strategy. More than 1/4 of Americans have been diagnosed with at least 2 major chronic conditions, a figure that is rising. This population faces uniquely worse health outcomes while accounting for over 66% of healthcare spending. So it's obvious that we have a population of patients who take up a lot of resources, a lot of time, a lot of money, and we really need to be able to manage these patients more effectively for their own good and for our own good, so that we can use the nursing staff that we have in a more appropriate way, and we can utilize resources in the most efficient way possible. So there's 3 main topics I'm going to touch on during this presentation. These 3 areas are crucial in helping to manage chronic illness among patients. The first will be inpatient and community-based palliative care. Secondly, we'll talk about how hospice has become more of a mainstream type of care. And lastly, voluntary action, advanced care planning. So palliative care programs have been implemented in order to add a layer of support and resources to the care team of chronically ill patients. The World Health Organization defines palliative care as an approach that improves the quality of life of patients and their families facing the problems associated with life-threatening illness through the prevention and relief of suffering, and also as a support system to help patients live as actively as possible until death. Chronically ill patients often have high costs of care and poor health outcomes, and thus might benefit from a disease management program. Palliative care programs, both inpatient and outpatient, need to be better understood by patients, caregivers, and healthcare providers in order to provide high-quality care focused on patient-centered goals. Although patients and family members are oftentimes involved in making critical healthcare decisions, they may lack comprehensive understanding of both the medical condition and expected progression. What we find a lot of times today in healthcare is we have lots of chronically ill patients who have multiple comorbidities, and the patients are overwhelmed, the families are overwhelmed, they're not really sure what everything means, they think that they're going to live forever, but they don't realize that everything going on in their lives really shortens their lifespan. You know, you've got a patient with diabetes and congestive heart failure, COPD, and you add those on top of each other, and these patients need to realize what their life expectancy is, what they can expect to experience during the rest of their life, and having to talk even about what to expect during the last days of their life sometimes is a good talking point. So palliative care definitely needs to be utilized more, but it needs to be better understood by healthcare professionals, because we're the ones who are going to make these consults and bring in the palliative care team to even start discussing this with patients. So the palliative care consultation is focused on discussions about goals of care. Communication plays a crucial role in high-quality palliative care, and it's often viewed as its primary intervention. Palliative care, in and of itself, is not a treatment. It's a program, and it's largely based on discussion. The most common reason for referrals to palliative care consultation services is the goals of care discussion. Conversations about goals of care involve conveying prognostic information, including potential options for and likely outcomes of treatment in the context of the patient's and or family members' goals, values, and clinical situation. The palliative care consultation is seen as effective in helping patients make often difficult transitions in goals when the referring team is concerned that the continued disease-driven treatment will be ineffective and burdensome, for options for future disease-driven treatments have been exhausted. So, say a patient has congestive heart failure or maybe end-stage COPD, and they keep coming back to the hospital, and they come back to the hospital and they get spruced up, they get tuned up with steroids and handheld nebs, and they get some antibiotics, and then they're back to baseline, and then they get discharged, but they keep coming back. And so after a while, it may be a good idea to get palliative care involved, since the treatment team may not feel that this disease-driven treatment is actually going to benefit the patient in the long run. So conveying prognostic information is an important component of palliative care conversations, because it, number one, increases patients' and family members' understanding of life expectancy and potential side effects of treatment. It enables patients and family members' decisions to be informed by a better understanding of outcomes, and it's associated with increased patient and family member satisfaction with care. We all know the more patients are involved in their care, the more they're going to be satisfied. If we can get them engaged, engagement is number one. Once they're engaged, we've got them hooked. We can teach them, we can explain things to them. They will want to learn, they'll want to understand. So engagement is key, which will later lead to satisfaction. And furthermore, goals of care conversations in general and prognostic information in particular increases the likelihood that patients will receive treatments that are consistent with their goals and values. This ultimately is a central goal of patient-centered communication. We talk about patient-centered a lot, and we talk about goals and values a lot in palliative care. We want to know what the patient wants. We want to know what is most important to you. Is it most important that you live until your daughter gets married in 6 months? Is it important to you to see your grandchildren turn 3 next month? Patients who have chronic illnesses have a hard time putting things in perspective sometimes as far as the future and what the future holds and how much time they have. So if we can talk about what's important to them and then make a plan to get them to that point. Let's make a plan to get a patient down the road 6 months to see their daughter get married and walk them down the aisle. If they have a goal and a patient-centered plan of care, they'll be engaged. They'll want to work with us, and overall their quality of life will be much, much better off. So, the importance of educating nurses about palliative care. We have palliative care teams who are made up of advanced practice nurses, typically with social workers. I know in the institution I work in, our palliative care team is an APN and a social worker. So the floor nurses don't typically know a whole lot about palliative care and what they do because they're not involved in the discussions typically or in the planning or referral process. But the reason it's important to educate patients on this is because it's not the responsibility of palliative care to dictate when a referral should occur. Healthcare professionals are capable of referring when they see the patient has developed a need. Therefore, the focus should be on educating those who care for these patients in primary care and in the acute care setting about speaking to patients to find out about their goals and preferences for treatment and end-of-life care. The situation regarding patient-centered care in the acute care sector at present is that it is often a case of too little, too late. In order to assure that the concept of discussing goals of care is embedded in culture, it must be incorporated into undergraduate education and practice for all junior medical, nursing, and allied health staff. Therefore, senior clinical leaders